felt that my neck and my shoulder have this extreme pain. To a certain extent, actually, it does give me these breathless feelings. So I visited a respiratory specialist. They did an X-ray on me and they discovered a nodule on my left lung. So I did a CT scan. They discovered that the nodule is present on my left as well as nodules present on my right as well.
So when I went to the polyclinic, the doctor took X-ray and then they noticed some non-regularity of the X-ray result. So that was why they were giving me a lot of antibiotics. But after 3 sets of antibiotics and X-ray, they realized that the irregularity on the X-ray does not go away.
Personally, I'm actually exercise quite a lot. I don't really drink, don't smoke. My family have no history at all. So the first question come across my mind is, why me? You know, I did all the right things in life, and why me?
If I'm not a high-risk person that will cause lung cancer, do I really need to go through this process?
The moment that they told me that they have to cut away my lung, I become very panicked. What next? Can I still jog? Can I still run? Can I still breathe? So all these questions start to float up, but at the same time, I know that I shouldn't be waiting for too long. From the day that I went to Prof sessions, the very first sessions, that he spent quite a long time explaining to me about what's happening. I would not say just only a medical care, but also the psychological care part of it is that how you guide the patients and give them the full comfort along the way.
They did a pre-assessment whether I was suitable for surgery or not. This is a precautionary measure, and the team discussed. The anesthetist also checked on me, all the standard checks, and from there we proceeded.
Advances have been made so much that the open type of surgery can be avoided. So a slit actually could be made on the side of the rib cage.
He did this, he devised this single port surgery where the camera, cutter, everything goes into one hole and just snip, snip, snip and remove it. So no bones cut. When I was awake, I was surprised that my chest is still intact, not sawn. And I could only feel the little bit of plaster at the side.
So all in all, my stay with the hospital was only about 3 days, including the day that it was spent in high dependency and in the operating theatre.
Life can actually get back to what we are doing in the past before surgery. So it is actually very much more of what you call us trying to actually overcome our own fear, which some of them could be unfounded.
So you don't need anyone like me, no need anyone to bring me in, no need anyone to bring me out. Just like that, as simple as that. For me, I'm very lucky, 2011, now 2016. I'm still happy.
I have done my right 3 months ago. I have just decided last 2 weeks to do my left, and I just have my left lungs operated on about 1 week ago. And I'm sitting down here talking to you, smiling at you. And in fact, 3 days after my discharge, I just did my 3.5 km morning walks again. So I'm perfectly okay. I'm still all right. No problems about it.
The thoracic surgery team worked together in order to give the patient the best experience during the hospital stay. We minimize the cuts to make it as small as possible. And by doing so, the patient will have much less pain and they can recover much faster. They can breathe well and cough well, and they can move about and mobilize well so that they can return to their normal lives as soon as possible.